Well, it's summertime, or summer's almost here, and that means a lot of time outdoors in the sun, lots of outdoor activities. And unfortunately, that might lead down the road for unprotected skin to skin cancer. Well, today we're going to talk about an interesting treatment for skin cancer. Honestly, I hope you never have to take advantage of this, but if you ever do, you're going to be so happy you paid attention today. So stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. And so I'm very honored today to have two doctors with me, and we're going to talk about a really interesting topic. First, we have Dr. Mitchell Weiss. You can say hello, Dr. Weiss.
Hello.
And then we have Dr. Sim. Hello.
Hi there.
Now, you are both radiation oncologists from Monmouth Medical Center.
Yeah.
Correct.
And you know what? I think the very first thing that we should do, Dr. Weiss, can you just explain, please, what is a radiation oncologist? I think there's going to be folks out there who might not even know what that means.
Sure. So radiation oncologists are oncologists who treat cancer, but we use radiation. So most cancer patients have a combination of different types of treatment to treat their cancers. So usually it may be a combination of surgery, chemotherapy, and/or radiation therapy. So any of those three, we, Dr. Sim and I, both do the radiation component, and we basically treat all different types of cancer. I know today we're going to be mostly talking about skin cancer, which is one of our easiest cancers to cure.
So my understanding is that skin cancer is the most commonly diagnosed cancer. Is that correct?
Yes, it's by far the most commonly diagnosed cancer. Most skin cancers are either basal cell carcinomas or squamous cell carcinomas. And they're so common that we actually don't even include them in the statistics on annual cases of cancer. But the good news is the vast majority of them are very, very easy to cure and are not life-threatening as long as we go ahead and as long as people go ahead and get treatment for them.
All right, so Dr. Sim, we're talking about a very specific treatment today, brachytherapy, if I'm saying that correctly.
You are.
Okay, well, all right, practicing now, brachytherapy. I'm guessing a lot of people have never heard about it. So maybe explain to us what that is.
Sure. So brachytherapy, if you break down the word, its roots are brachy, meaning short, and therapy, obviously, meaning treatment. And so what it is that we utilize radiation seeds to deliver radiation treatments, because seeds, as opposed to the other type of radiation, only goes a certain distance. So we call it short therapy because it's able to treat very small distances and very limited amounts of normal tissue. So most people might know brachytherapy commonly in, for example, treatment of prostate cancer, where people might have heard of something called the seed implant, right, where we put tiny little radioactive pellets in the prostate because those little pellets deliver radiation only to the prostate and to only small volumes. But we also use that same seed or a similar seed for treatment of other cancers. And I know today we're talking about skin cancer, so we do use a radioactive pellet or a tiny seed to deliver radiation treatments to the skin. And because of the nature of that seed, it only penetrates through the skin and doesn't go deeper into the body. So that's the beauty of using this type of treatment.
Now, is this treatment, now let me just first say, the people that I know who've had skin cancer, and unfortunately far too many, they have all been treated with more of a surgical procedure, cutting. I don't know how else to say it. And this is clearly very different, correct?
Correct. So this is a non-invasive approach. So we don't do any cutting or removal. And so one of the beauties of this procedure is obviously that there isn't a scar. And so it does have some cosmetic advantages. And so the most common places where we utilize this technique of treatment are in places where scars may not be well hidden or may change the appearance in patients' faces. And so, for example, one of the more common places we treat are areas on the nose or on the lips, where even a scar can affect the way you look or the way you perceive yourself to look. And so we utilize this as a scarless measure of treatment.
And how effective is it?
It's very effective. The statistics are that they are pretty close to the effectiveness of surgery. So I usually quote in patients who are candidates for this procedure, cure rates in the neighborhood of 93 to 95%.
Excellent. So, Dr. Weiss, is this for any kind of a skin cancer treatment, or is this a very specific type?
Right. So a lot of skin cancers can be treated with this technique, but it would obviously require evaluation by a radiation oncologist, because we have to make sure that it's a relatively small lesion. We can treat lesions up to about 3 centimeters. But if it gets bigger than that, then usually we cannot use this procedure. And it has to be relatively flat. It can't be more than a couple millimeters in thickness. But most skin cancers on the face, for example, do fall within these parameters. Another really nice thing that we can, I apologize, another nice advantage of this treatment is for patients who might not be good candidates for surgery. So if they're on multiple medications, blood thinners, for example, if you have surgery, you have to often stop those medications. Whereas with brachytherapy, you can stay on all your regular medications without an issue. You wouldn't have to come off blood thinners if you were on blood thinners. So we can really treat almost anyone regardless of their other medical problems.
Dr. Weiss, are you awake during this procedure?
Yes, so you are awake. The procedure is quite quick. The entire course of treatment is 6 treatments. It's 2 times per week. So typically we do it on like a Tuesday and Thursday for 3 weeks in a row. You're in our department for about 30 minutes in total, but you're in the treatment room about 10 to 15 minutes, and the actual radiation is about 3 to 5 minutes each day. And you do not feel anything during the treatment. You can go about your day right afterwards as if you didn't have anything done that day. So it really has minimal impact on your daily routine or schedule.
Well, I think it's incredible that, you go there, you get your treatment. There's no scarring, not invasive. You don't need anesthesia, obviously.
Right.
That's pretty incredible right there. Dr. Sim, what about people who might ask, well, what about your kind of implanting radiation? How is that going to affect my body? How long does that stay within me?
So the radiation seed is never left in you. So it really is utilized to deliver the treatments. And so the seed goes into an applicator, which lays on your skin. And the seed actually never comes in contact with you. It just goes in the applicator, emits radiation from the seed itself, and then withdraws itself back into a shielded enclosement or a machine that actually delivers the treatments. And so the only time that you're ever exposed to radiation is at the time of treatment. So when you leave and when the machine has retracted its seed, there's no radioactivity in the room. There's no residual radioactivity that you go home with. And so it's perfectly safe in terms of exposure to loved ones and anyone else you come in contact with. The purpose of using that seed, as we mentioned before, is that it only penetrates a certain distance through the skin. And so really we prescribe to about 3 millimeters depth. And so really anything beyond that really gets much less doses or 0 doses. So safe to anything deeper than that.
And Dr. Sim, is this suitable for children, for adults, for people of all ages?
Yeah, fortunately, skin cancer tends to be a malignancy in the older population, more as a product of the fact that the underlying cause tends to be chronic sun exposure. And so we don't typically see skin cancers in, children. And so, this treatment is predominantly for adults.
All right. It doesn't really feel like there's a downside to any of this. Would that be fair to say, Dr. Weiss?
Yeah. I mean, I think that it's extremely well-tolerated treatment, excellent cure rates. There are some side effects, but very well tolerated. Really, the side effects are that in the area of treatment, which will be basically a circle that's either 1 centimeter, 2 centimeters, or 3 centimeters in size, you will get redness of skin that will be there for about 2 weeks or so. And sometimes you may form a little scab in that area the week after treatment, and then the scab falls off and the cancer should be gone. But in terms of significant side effects, really essentially zero. So very well tolerated and very effective treatment.
Now, for people listening out there, if you want more information about this, I will put a phone number in the comments so that you'll be able to call the folks at Monmouth Medical Center, the Radiation Oncology Department. You can find out more about this. And, as I said, I hope no one ever needs the service, but I think this is a pretty fascinating thing because most people that I had heard of this before for prostate cancer, but I love the fact that it's non-invasive. I mean, especially when it's on your face or, for cosmetic reasons, let's be serious, vanity.
Sure.
So yeah, that's really, I think that's a big deal. All right. Dr. Sim, any last things you want to add?
No, I think we've covered the
Okay.
key topics of this procedure. I think in
Excellent.
general, people are very happy with having had treatments. It's very common that when we treat a patient, that when they subsequently ever develop another skin cancer somewhere else, that they're oftentimes repeat patients. I think just kind of gives some testament to how
Yeah.
happy people are with this type of treatment.
Well, why would you ever want another treatment if this feels like it's the way to go? Dr. Weiss, any last words?
No, I agree exactly with what's been said. I just think that it's an excellent treatment option that should always be considered. So even if someone's offered surgery, we'd be happy to see them and discuss the pros and cons of this treatment versus a surgical approach for any of these skin cancers.
Okay, very good. And again, I'm going to, Dr. Weiss and Dr. Sim are both at Monmouth Medical Center, and I will put the number in the comments for you to reach out to get more information or maybe take advantage of this. Obviously, it's a superior procedure over surgery, no scarring, in and out, no anesthesia, no pain, right? I love it.
Correct.
But again, hopefully no one will need it. All right. Well, thank you so much for being with me today, both of you, Dr. Weiss, Dr. Sim. Really, really interesting to be able to, share this information. I think a lot of people were not familiar with this, and I think that I don't want to say I'm going to bring you customers, but I think it's a great option. Okay.
Well, thank you for having us.
So remember out there, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI. Bye, everyone. Bye, guys.
Great, thank you.
Goodbye.